Well, it's a rainy Sunday here in Atera, and my plan for today was to plant this macadamia and this tangerine, which is sitting in its pot there, and the banana plant that you see in the back, which took a beating in the last week when we got a cold spell. Lost a couple leaves. It's time to plant it. But seeing as how it's raining, that ain't gonna happen today. I'm not feeling it, so I figured I'd take the opportunity to talk about public health care here in Paraguay. And there are two different types of public health care. There is completely free health care for the indigent, those who have no money. And there are special facilities that they can go to, basically to get treated, specific hospitals and health centers. But of course, that is not the best quality. You get what you pay for. So there's another system, which is a government-run system, which is called IPS, Instituto de Previsión Social. Okay, is what it stands for. And that has been functioning since 1943. It was started. And the way that works is I'm enrolled in IPS. I have IPS insurance too. Even though I have private insurance, I supplement it also with IPS. And the way that works is, as an employee, you pay 9% of your salary. So let's say you made $1,000 a month. You're gonna pay $90 for this insurance, okay? And this is total health care, complete coverage. And your employer pays 16% of your salary. So in other words, if you were making $1,000 a month, $90 comes out of your pocket, but your employer pays $160 to the IPS system. So basically, it's 25% of your salary is what goes towards your IPS coverage. Now, IPS is not only healthcare, it's also retirement. So basically, after you do 30 years of work, 30 years of being enrolled and paying into the system, like Social Security in the States, and you're over 55, I think it is, you can get your retirement, and you retire at full salary, whatever you're making. So, but the issue is we're talking about healthcare right now. So, getting back to the healthcare part of it, the problem with IPS is, like every other thing that's run by the government, it's screwed up. Okay, the problem is that back in the 90s. One of the presidents that was president here in Paraguay, dipped into the funding, much like Bill Clinton dipped into the Social Security funding in the 90s. That happened here too. And they basically built a lot of new facilities and then never completed them, and money was stolen, basically embezzled, and anyway, make a long story short, the IPS system, even though it collects 25% of the monthly salary of everybody who's enrolled, is hurting for money. So when you go to an IPS hospital, you're not at the same level you are as if you go to a private hospital like La Costa or Santa Julia. Okay? Basically, you go to the central hospital of IPS. When you go there and you're waiting in line, I've never had to do this, but I've been with friends and family members who have had to do this. It looks like, I don't know, a bunker at Stalingrad, or at Dien Bien Phu or something like this. You got people bleeding all over the place. It's freaking horrible. I mean, they're waiting to get enrolled into a room, given a room, and start getting their treatment. I mean, there's people standing in the hallway, laying down in the hallway. They're with their family members. I mean, it's terrible. The thing is, with IPS, because the way the system works here is, and I'm going to do another video about this too, everything in Paraguay is about connections and friendship. So if you've got a contact in the system, you bypass that and you go to one of the great places that IPS has. You go to a good IPS hospital and you get good treatment and everything else. If you don't, you're with the also-rans and you get what you get. And like I said, I mean, it's not a pretty picture, IPS. It's consistently being looted, and because of the retirement system, it's unsupportable. It's much like the United States Social Security system. I paid in for a lot of years Social Security, and I don't think I'm ever going to see a dime of it because I think the whole thing is going to collapse before I ever get to the age where I'm eligible to get my money back. But anyway, I was forced to do it. At least here, you're not forced to it. You can choose not to enroll. Now, having spoken so badly about IPS, I will explain why I'm a member of it. Why am I enrolled in it? Private hospitals give excellent care, but for something big, if you have a major disease, you're not going to have coverage for it. For example, if you get cancer, or if you needed a transplant, an organ transplant, or something like this, something major, the insurance that you have, the coverage that you have in a private hospital is not going to cover it. And you're going to be looking at thousands, tens of thousands of dollars, whereas in IPS, that will be covered. And IPS, despite the bad reputation that it has for having inadequate amount of medication, having facilities which are not kept to a good standard, or the standard that it should be for a hospital. Aside from that, they have the best doctors in Paraguay, and I will just say, my wife's uncle, my father-in-law's brother, is a doctor, and he is an endocrinologist, I think it's called. But anyway, he specializes in glandular stuff, thyroid gland, and I don't know. I'm not well versed in the different medical fields, but anyway, he is like the number one guy in his field in Paraguay, and he, as a doctor, is required, even though he has his own practice, he is required to donate basically a certain amount of hours per week where he works at IPS hospitals doing his thing. And like I said, I mean, he trained in the States. He worked for several years in Chicago. So he's obviously fluent in English. He's a cool guy. But I know for a fact that IPS, like I said, they have great doctors working for them. The problem is in the infrastructure and in the supplies that they have. But in our case, IPS, being a member of IPS works because he's in Paraguay you say palanca, he's a lever, he's our contact. So if, God forbid, anything ever happened major to myself or to my wife or to my child, he can pick up a telephone and get us, what we need and what we're supposed to get, by being a member of IPS. But anyway, I'm kind of rambling on about this, I guess. IPS is basically an option if you come here and you're working for a company. You can't just come here and say, yeah, I want to sign up for IPS. You got to have a job with a company here, and that is part of the labor code, part of the labor law. They are required to enroll you in IPS.